Hey there, Dr. Mike Stair here, and I want to give you a tutorial about how to stretch a critical muscle called the psoas. The psoas is one of your hip flexors. It attaches from your spine to your pelvis to the upper part of your femur. And many people complain of tightness in the front of their hip. So what I want to do is I want to go over some unique ways to stretch that muscle, and I want to go over why that's important. The psoas can be tight due to a variety of reasons. One reason it can be tight is because it's your body's way of reacting to an irritation perhaps in your back or an irritation of your hip. So the body reflexively will react by tightening the muscles around it to sometimes improve stability. So when you go to stretch the psoas, the first thing I tell people to do is if you have tightness there, figure out why it's tight. Rather than just reactively stretch the muscle, look to things that you're doing in your day-to-day life, such as prolonged sitting or poor stability of your spine, or any pathology that might be going on in your hip. Sometimes the body reacts by tightening to protect. So stretching the muscle isn't really getting at the cause of the problem. Sometimes it's again due to postural issues, prolonged sitting. That can also be something that's fixed better by just adjusting your day-to-day habits as opposed to spending inordinate amounts of time stretching the muscle only to find that it gets tight again because you haven't addressed the cause of the problem. So assuming that you are addressing the causes and assuming that the tightness is not just purely due to irritation, I want to go over how to actually stretch that muscle. Now, bear in mind, this is not a simple stretch to do. Many people are going to struggle to do this properly, but if you have the key components to this, you'll have a far greater likelihood of getting the stretch without any of the negative consequences of unintentionally irritating other structures. So there's four main parts to the stretch, and the first and most important is in regards to controlling the lumbopelvic position. Let me show you a few videos from different perspectives, and that can give you guys, I think, a pretty good idea about how to do the psoas stretch on your own. All right, here's a side view of the psoas stretch. I want to point out the start position. In this position, the psoas is on a little bit of a slack, and I'm doing that because the first goal I have is to try to get lumbopelvic flexion. And the reason why I want to get lumbopelvic flexion is because the origin of the psoas, which is on the spine here, needs to be stabilized. And that is one of the biggest mistakes that people make when they do this. So lumbopelvic flexion is the first part of the motion. The second part of the motion is going to be hip extension. And as what you'll see here is that hip extension is actually not a lot of motion in order to get that extension. So it doesn't need to be a whole lot of motion here. We're probably getting, a little bit more than 90 degrees, probably about 110 degrees, or I should say only about 10 degrees here. So it's not a lot of motion, but here's a big mistake that people make. What ends up happening is that they go instead into a lot of flexion of the spine, a lot of extension of the spine, like this. So here's the big mistake. This is a huge amount of lumbar extension, and the pelvis goes forward. So there's actually not a whole lot of hip extension here. In fact, the angle here, it's 0 degrees of hip extension. And that's about a 90-degree angle with the plane of the pelvis here because there's so much extension. So rather than getting the stretch here in the psoas, the stretch or the strain is now a lot of compression here in the lumbar spine. And the intent to stretch the psoas is actually poor. There's also a shear motion, which for those with who are sensitive to shear at the spine are going to have more problems. So not only is this not as effective of a stretch, it actually puts more strain on the back. And if you have sensitive spinal tissues, you'll definitely feel that. So instead, this is what the stretch should look like. So again, lumbopelvic flexion, which is this right there. So as you see what I did is I moved my belt buckle up and in. which essentially rotates my pelvis in order to stabilize my lumbar spine position. If my arm wasn't there, that's approximately where that would be. And you can see my pelvis is level or slightly tilted posteriorly or backwards. And then move forward into extension. And as you see here, that angle is actually greater than what you saw in the prior one. So you're actually getting about 10-15 degrees of extension here, which is more than you saw when I was doing that erroneous position here that so often we see people doing. That can cause some problems. So you don't need to move very far in order to get a good stretch. So now you'll see a front view of the psoas stretch. And right there, what I did there was I did some hip internal rotation. Now, so that's the third component of the psoas stretch. We have lumbopelvic flexion, hip extension, and the femur needs to rotate inwards. Because the psoas coming through here is somewhat of an external rotator, so rotating inwards will pull that psoas in, and that will help lengthen the psoas. One of the ways we can tell that your hip is rotating in is that you'll see your lower leg move outwards. And then we'll start seeing the fourth component of a proper psoas stretch. Slight right side bending or side bending away from the intended target. So the psoas has some attachments to the transverse process on the outer part of the spine. So it has some origins there, insertions, and through here. So you can see by doing a little bit of side bending, you're actually going to lengthen that psoas just a little bit more when you do those components of internal rotation and some lateral side bending. Now remember, you don't need to do much side bending above here. You know, it doesn't need to bend a whole lot here. And there's no advantage to having the arm go up and around over your head. In fact, it could be a slight disadvantage because the latissimus could pull you into extension, which would negate your goal of locking yourself in lumbopelvic flexion. Now let's look at the standing version of the psoas stretch. Here, I've already got myself into extension and locked my pelvis into lumbopelvic flexion, moving up and back. And since my knee is in a very limited amount of flexion here, the stretch is a little bit more focused on the psoas as opposed to the other hip flexor, the rectus, which comes all the way down through here. So this will preferentially stretch the psoas a little bit more, plus it's a little bit more accessible than the kneeling or half kneeling versions. So that's as simple as it is. That's what the standing version of the psoas stretch is. Again, adding all three components in, or I'm sorry, 4, lumbopelvic flexion, hip extension. Then by turning the femur inwards, you have hip interrotation, and you can't see it very well from this vantage point, but a slight lean or side bending away. All right, I hope you found that helpful. Any questions, please let me know in the comments, and stay tuned. We'll have some more great content for you in the future. All right, take care.